Start.
Hello, this is Dr. Trivedi, a doctor working in this clinic. May I confirm your name and age, please?
Hello, doctor. My name is Andrew Hill and I'm 33 years.
How may I address you?
Please call me Mr. Hill.
Okay, Mr. Hill, today I'm going to discuss about your health issues. Is that all right?
Okay, doctor.
Okay, and during our discussion, I might take down some notes which will be strictly confidential. Is it okay?
Okay, doctor.
Okay, now, Mr. Hill, can you please tell me what brings you here today?
Doctor, for the last 3 days, I noticed that I am having some burning sensation during passing my water. And this is increasing in the meantime. And also, I think that I have become somewhat feverish. So
Okay,
I visited my GP and he sent me here.
okay. I'm very sorry to know. I will try my level best to find out what's troubling you. Okay, and may I know that you told that there is a burning sensation, and may I know that when exactly 3 days back did it start? At which time of the day, or what were you doing at the time? Can you please remember?
It was in the morning time.
In the morning. Okay. And since then, has it been present for all the time?
Yes, doctor, and it is increasing. The burning sensation is increasing.
It's increasing. Okay. And do you feel this burning sensation throughout the whole water work, or do you think that just at the beginning or at the end it's more?
I think all the time.
All the time? And do you feel that you told that it's increasing, but do you think that there is any specific time of the day when it's more or less?
No,
Okay. Do you have you noticed that there is anything making it better, like drinking water or something like that?
no,
Anything making it worse?
no.
Okay. Well, if I tell you that zero is no difficult problem at all, and 10 is the highest burning sensation or highest pain that you can experience, then how would you like to grade this sensation?
I will say it is around 4.
4. Okay. And may I ask you that have you noticed any soreness? Actually, it's a private question. Will it be okay if I
Okay.
tell you, ask you? Okay. May I know that have you noticed any soreness around your private parts?
No,
Okay. Any abnormal discharge through your private part or through your private passages?
no.
Okay. Okay. And do you have any tummy pain
In my lower tummy, I have some pain.
in your lower tummy?
Yes.
Okay. For how long?
For last 3 days,
For last 2 days. Has it been present all the time?
sometimes it comes and goes, but mostly during passing water.
Mostly during
Passing the water.
passing the water. Okay. And can you please describe the pain for me? How is it? This pain?
Something burning and dull pain.
Pardon. Okay. And have you noticed that it goes to anywhere else?
No.
It stays just in the lower zone.
Yes.
Okay. Anything making this tummy pain feel better
No.
or worse?
No.
Okay. And how would you grade this tummy pain? If 0 is no pain at all and 10 is the highest pain that you
4.
can experience? 4. Okay. Do you have any lumps and bumps in your tummy?
No.
Okay. And you told that you also had some feverish sensation. Okay. May I know that when did you first notice this feverish
For the last
sensation?
3 days, doctor.
Okay, for the last 3 days. Okay. And may I ask you that have you ever noticed this type of problems before in your life, or is this the first episode?
It also happened before.
Okay. May I? Can you please tell me a bit more detail about it?
Doctor, it was around one episode was around 9 months ago, and another episode was around 15 months ago, and the first episode was around 2 years ago.
Okay. So there has been 3 more episodes of
Yes,
this. Am I right?
yes.
Okay. Okay. Let me just ask you in the meantime one question that have you ever noticed any blood in your water work?
No,
Okay. And that's all right. And you told that there has been 3 previous episodes of this. And have you ever noticed? Have you ever seeked any medical attention ever for these problems?
yes, doctor.
Okay. Can you please tell me a bit more detail about that? What happened in those?
Yes, doctor. The doctor said that it was due to my catheterization. That I do the self catheterization myself, so that there was some bugs in my water.
Okay, okay, I can get it. And may I just at this point know that why did you have to do this catheterization?
Oh, doctor, I have the multiple sclerosis. For that, I sometimes retain the water. I cannot pass the water, so that I have to do the catheterization myself.
Okay, I'm very sorry to hear it. And okay, and may I know that for how long have you been diagnosed with multiple sclerosis?
Last 5 years.
That's 5 years. Okay, and uh, at the time of being diagnosed, okay, what were the symptoms or what are the problems that you used to face? Can you remember?
Yes, doctor, I had weakness on my right side. I had some problem with my vision.
Okay, and now and then you told that there has been 5 years that have gone by, and during these 5 years, how are the symptoms? Are they improving or are they not improving much? What do you think?
They aren't improving mass, rather they are deteriorating.
They're deteriorating. Okay, so now can you please tell me what the symptoms are or about this multiple sclerosis? Do you have any weakness or any problem in
Yes,
maintaining
doctor, I
vision?
cannot walk myself.
Okay, you cannot walk yourself. I can get it now. I'm very sorry to hear. Okay, and so I guess you need some help. So are you provided with help or are you linked with the multiple sclerosis societies?
No,
No.
no.
Okay, I can get it. And okay, now let me come back again to your symptoms. That I'm just going to ask you some questions which may not be associated with your symptoms. Is that all right?
Okay, doctor.
Okay. Do you have any headache?
No,
Any difficulties in vision now?
I cannot see on my right eye.
Okay. For how long?
Last 2 years.
Okay. I'm sorry. And have you seeked medical attention that whether it can be treated or not?
No, it cannot be treated, doctor said.
I'm very sorry to hear. And what about your left eye? Do you think that it's working well?
Yes.
Okay. Do you have any skin rashes?
No.
Okay. Any soreness in your mouth?
No.
Okay. It's a private question, but let me ask you that do you have any soreness in your private parts?
No.
Okay, any joint pain?
No.
Okay. Any abnormal sensation in any parts now?
No.
Okay. And you weakness, you told that you're generalized weak, but can you specify that whether there is a weakness in any parts of our body, like right part or left part?
Right part.
Right part. Okay. For how long now you're facing this?
It is increasing and more for the last 2 years.
More. I'm very sorry. Okay. And do you have any problems in keeping balance?
No.
Okay. Any difficulties in speech or swallowing?
Not now.
Okay. You told that you have had some raised temperature, and may I know that have you measured it this temperature for the last 3 days?
Yes, doctor, it was 100 degree.
That's 100. So did you take any medication like paracetamol or something like that for this fever,
No.
raised temperature? Okay. And is it present all the time or does it go away? What do you think?
I think more at night.
More at night. Okay. And do you have any night sweats?
Yes.
Okay. For how long have you been having this?
Last 3 days.
Last 3 days.
Yes.
Okay. You told that there have been some previous episodes as well. So 3 episodes. Did you had any raised temperature or night sweats at those periods as well?
Yes.
Okay. Okay. I'm very sorry to know. Okay. And do you notice? Have you noticed that there is any changes in your weight recently?
No.
No changes. Okay. And any weather preferences?
No.
Any lumps and bumps anywhere in your body?
No.
Any lumps and bumps in your neck?
No.
Okay. And may I know that what about your bowel movements? Is this all right?
Yes, doctor.
Have you ever noticed any blood in your bowel movement?
No.
Okay, that's all right. And any okay. And now let me ask you some more questions. That apart from being diagnosed from multiple sclerosis, do you have any known disease condition?
Yes, doctor.
May I know about it?
I had a condition called ITP.
Sorry, ITP.
Yes.
Okay, ITP. Okay. For how long?
It was diagnosed 8 years ago.
Okay. And okay. And how is it to treat? How is it? Is it under control? Do you seek any regular medical attention for it?
No, doctor cut my spleen and they gave some medication at that time.
Okay, some medication at that time. Okay. And actually, may I know that when you cut your spleen, actually, there can be some requirements for some type of anti-bug medication. Okay, that can control the bug infections. Have you been prescribed those medications?
Yes, doctor.
Do you take those regularly? Actually, some medications can be should have might have to be taken for life.
Yes,
Uh,
doctor.
do you take? Okay, okay. Okay. And at this point, may I know that which medications do you take? There are some conditions that you have, like multiple sclerosis, ITP, and you also have had your spleen cut down. So, may I know about the medications that you have been taking?
Yes, doctor. I'm taking
Okay.
steroid tablets and another medication called fingolimod and uh, penicillin V and some omeprazole.
Okay. 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 So, may I know that has there been any recent
2 minutes
changes in the
remaining.
medication? 2 minutes remaining. Okay. Has there been any recent changes in the medications?
No,
Any allergy to any medication?
no,
Any over-the-counter medication?
no,
Okay, and any medication through your blood channels?
no,
Okay, and may I ask you some personal questions? That do you smoke?
no,
Do you drink alcohol?
no,
Okay, and just a more personal question: that do you take any recreational medication or party drugs?
no.
Okay, and just may I know that do you have anyone in the family having such similar type of severe condition or any known kidney disease?
No,
Okay, and may I know that what do you do for a living?
I cannot do any active works,
Yes.
doctor.
I'm very sorry. I'm very sorry. And are you well supported economically and financially?
I think I am.
You think okay? And may I know that have you been to any travel recently?
No,
Okay. And just another personal question, if you let me ask that do you drive?
no, doctor. I cannot move
Oh, you
myself.
cannot
I
drive. Yes,
may
I'm
drive.
very sorry. Very sorry. Yes. And may I know that whom do you live with?
Leave me with my parents.
Okay. Okay. May I at this point know that what your concern is?
Why I am having this, doctor?
Yes, actually, at this moment, I will have to examine you thoroughly and do some blood tests and some other tests. But as long as I have taken history from you,
Time
I
up.
think that okay.
You want to examine?
Yeah, I would like to examine the patient.
Go for that.
Uh, okay. At the beginning, I would like to check the pulse and I would like to measure the blood pressure of this patient. Okay.
Okay.
Uh, okay. And whether to see whether he or he is in shock or not.
No.
Okay, and then I would like to tell him to, if it's possible, to expose to see whether he is catheterized at this moment and whether there is any skin lesions, any ulcerations in his private parts.
No.
Okay. And okay, and now I would like to look at his eye, whether there is any cataract present or not in his left eye, and his eyesight is compromised. And then I would like to look at his oral cavity, whether there is candidiasis present or any candidiasis present or not. And
Yeah.
then I would like to listen to his chest. Okay, and listen to his chest, and also I would like to listen to his lung base for any pulmonary edema present or not, and then go to his leg to find out any leg edema present or not. And I would like to complete the examination by doing the urine dipstick test, and also urine dipstick test, and also measuring the blood pressure of the patient.
Okay. Anything else?
Uh, Anything else? I cannot remember at this moment.
Plantar and power.
Yeah, plantar power and some at least plantar and a knee jerk should be seen.
Okay. So have you reached at any diagnosis?
Uh, I think that the patient might be suffering from recurrent UTI. Okay,
What do you mean by UTI?
there can be some urinary tract infection. There can be some possibilities associated, like the patient is exposed to a profound immunosuppression due to his taking of long time steroids, also fingolimid, and his splenectomy as well. So there is high chance that he is suffering. He might be suffering from uh, some organisms like tuberculosis. So renal tuberculosis can be a possibility, and also other atypical organisms like chlamydia. Okay, this can be present as well, and also normal organisms that can cause UTI, like E. coli, Escherichia coli, or Staphylococcus aureus. I think this can also be cause for this patient.
Any other risk factors that can be present with this patient?
Uh, uh, I just can't remember at this moment. ITP.
Okay, this patient actually said that he do the self catheterization. Can it be the cause?
Yeah. Self-catheterization itself can be the cause. I just forgot to tell it. Self-catheterization can be a cause, and
This
all the
was
other
the
things can
cause.
also be causes.
This was due to the self catheterization. There might be some problem with the technique. So you should have asked details
Okay.
about that. Okay.
Mm-hmm.
So how will you investigate this gentleman?
Okay. Okay. At the beginning, I will have to do some routine blood tests, including complete blood counts, to look for any anemia and also any signs of infection by looking at the neutrophil count, and also thrombocytopenia for IT. And then I would like to do some markers of inflammation, including ESR and CRP. After that, I might have to do electrolyte, some routine and microscopic examination, and urine culture and sensitivity, and also ultrasonogram of plain X-ray of QB region, and also ultrasonogram of QB region. And I think in this type of patients also ultrasonogram should be done with postvoidal, after postvoidal residue, and with postvoidal residue, I think, and also PSA level can be seen, I think, in this type of patients. And I think some yes, these are the main investigations I think I would like to do.
Did you mention
Yes.
urine culture sensitivity.
Yeah, urine RME and urine culture.
Okay. How will you manage this case?
Uh, well, actually, it's a first of all, I will have to educate the patient and counsel him. And then it's some I will have to form a multidisciplinary team, including occupational health therapist, physiotherapist, then also social services, neurologist, urologist, nephrologist, okay, and specialist nurses as well. Then I might have to I will have to review his whole self catheterization technique, whether he is doing it appropriately or not, and if not doing appropriately, then we will have to we will have to train him up again. Okay, train him for self catheterization. If needed, we might have to stop his self catheterization, advise him not to catheterize himself as well. Then I will, based upon the results of the urine culture, okay, we might have to um, do the managements as in that way. And I would also like that this patient is not actually linked to the multiple sclerosis society, so this can be difficult for this type of patients. So I would try to link him with the multiple sclerosis societies, okay, so that he can get some more help in this matter, and also other multidisciplinary team approach.
Suppose this patient have recurrent history of he frequently needs self catheterization. In that case, do you think any other alternative that can help him?
Yes, I think supra PB catheterization can be done.
Okay. Okay, your history taking that was fine. Just thinking that patient said self catheterization. You should have asked about our recent self catheterization. Was the technique appropriate? And,
Mm,
did he use the sterile technique? Okay, so that you could
mm,
get an idea.
mm,
And how frequently
mm,
does he need to do that? So that you could
mm,
get an idea.
mm, 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 mm,
Okay,
mm, mm.
and apart from that,
Okay.
everything was fine.
Okay, but I okay.
Something about the patient cannot move himself. So you have asked about driving. That was I
Yes, yes,
think
yes. It was a blunder. Actually, I just forgot. I just told it in the flow. That was a very big mistake, actually. Okay, so the things that I told about the DDs, are they all right?
if this was catheterized induced urinary tract infection, there can for male urinary tract infection there are certain other risk factors like any calculus, okay,
Mm,
any
yeah.
sexual exposure, any growth,
Mm-hmm. Sorry, any?
growth.
Yeah, yeah. So calculus, sexual exposure, growth.
Yes,
Yeah, these are important. And atypical organisms, aren't they
and
not
and
important
and,
because he is in
and
proper
also
form?
some structural abnormality like vesico-uretary reflux,
Yeah, yeah, yeah.
prosthetic hyperplasia.
Yeah, yeah, yeah. Mm, mm. Okay. Okay, but what I told that there could have been some other causes of what I told that sorry, some cases of profound immunosuppression due to steroid or something like that. Is it correct or wrong?
No, that can cause.
Okay.
There is usually
Okay.
candida infection is more with the immunosuppression patient. Candida is important cause.
Yeah, 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 yeah. That's very important. Yeah.
Okay, fine.
Okay. Would you give me the next case now?
Yeah.